The Community Memorial Health System Speaker Series Online is brought to you by Mission Home Health. Mission Home Health and Hospice is committed to taking care of people by providing the highest quality, cost-effective care wherever the patient calls home. With over 14 locations, Mission delivers skilled home health, hospice, and palliative care services to more than 3,000 patients a day. As a preferred partner with several health systems, Mission works with providers to customize each partnership to provide exceptional coordinated care. Visit our website to learn more at www.homewithmission.com. We take care of people, and one call does it all.
Good evening. My name is Sun Moon Lee. I'm a general pediatrician. I work for Community Memorial Health System. Thank you for joining us tonight. Our topic tonight is back to school, and I know that for some of you, your children have already gone back to school, and for Ventura Unified School District that will be going to school next week. And so this is just a general conversation about back to school and some topics that I think are very important. These are some of the things I talk about at my physicals and well child checks. I think when we think about back to school, we think about our kids, and this is my son Ben. This is when he, on his first day of kindergarten, and so we took a picture and he has his little mask on. I think each time that your kid starts primary school, or whether it's kindergarten or first grade, or whether or not it's going into middle school or their first day of high school, I think we're all very nervous as parents because we want the best for our children. And I think what we're hoping for is what is on the bottom right of my screen is a happy graduation and a successful year where my son had fun and he loved his teacher and things went pretty well. I mean, of course, there were a few hiccups of being sick and things like that, but I think this is what we're looking for. And each time I would watch my son walk into school, my heart kind of melted, and it was just really amazing to watch him go to school every day. One of the first things I think is really, really important to talk about is what we do basically 1/3 of our life, and that's sleep. So during my physicals recently, I've been asking parents how kids are sleeping, and I think just like me, many families have been letting their kids go to sleep a little later. And one of the things I commonly hear is, Dr. Lee, it's summertime, and so they're going to bed a little later, and so sometimes they're going to bed at 10:30, 11:30, 12:30. I did hear a family tell me that sometimes the kids are going to bed at 3 or 4 in the morning, and that usually when we go back to school, we go to bed at 8:30. And then I've also been hearing kids are getting up at noon, 1 or 2 in the afternoon. And so if your kids are anything like me, I am not very good at adjusting my sleep schedule. If your kid goes to Ventura Unified, or if your kid's going to start school this week, I would say start getting them ready to go back to school. Start getting them up a little earlier. Once they get up earlier, if they're tired and they're wanting to nap, don't let them nap. Make them stay up the rest of the day. Try to get them outside, out in the sun, and then put them to bed a little earlier. I think it's really important that kids get a proper amount of sleep before going to school, and we don't really want our kids, acting like zombies in the first day of school. But sleep is so important, and the American Academy of Pediatrics does have recommendations when it comes to sleep. If you're a 3 to 5-year-old, you're supposed to get about 10 to 13 hours of sleep, and that will include your naps. If you're a 5 to 12-year-old, you should be getting about 9 to 10 hours of sleep. But one of the things that I always ask at my physical is, does your kid nap? And so, there are some 5-year-olds who they still need their nap, and that can be totally normal. But if your 7, 8, 9, 10-year-old is starting to nap, if your teenager is napping on a consistent basis, then sometimes that can be a little bit of a red flag. My wife enjoys her naps. She's complained that she hasn't been able to nap since we had kids. But if your kid is starting to nap and when they come back from school, then you start wondering, is there something going on? There's been about 4 to 5 cases. I've been, since my residency into training till now, about 15 years, I've had about 4 or 5 cases of kids who've had sleep apnea. And it turned out they were snoring and they were gasping for air in the middle of the night. They kept waking up. And it turned out after we got their tonsils taken out that they actually slept much better and their energy was better. The headaches went away. So if your kid is napping, sometimes that can be a red flag. We're going to talk about this topic in a little bit, but it can be a little bit of screen time. Sometimes kids will sneak the phone and take the phone into their room, or they just have the phone into the room and they're watching videos on YouTube or playing games all night long, and that's keeping them up and causing them not to sleep very well and then needing to nap. For teenagers, sometimes the recommendation is 8 to 10 hours of sleep. Teenagers, they can also have screen time. A lot of times they're on their phone, texting their friends, on social media. But sometimes for some of our children, they're just very high achievers, and so they're trying to get those grades, because I do feel like in the past 10 years, getting into college has become more difficult. And so, sometimes our kids are up late because they're studying and they're working hard. I did forget to mention that if you do have any questions as we go along, you can put those questions in the text box, and we'll try to answer them as we go along. If I don't know the answer to the question, I will say so. I don't like to guess too much. I like for parents to have solid information, and so if I don't know the answer, then I will actually get back to the staff, and they will personally try to get that answer out to you. So sleep, and poor academic performance because of sleep. So if you don't get enough sleep, there's a lot of different things that show up, and one of them is that your kid can start to act like ADHD. And so lack of sleep, sometimes when I have parents bring their kids in for ADHD-like symptoms, I actually ask about the sleep, because if they're not sleeping well, the symptoms are going to be worse. It can also lead to a kind of really grumpy and hyperactive child. And so sleep is really important, especially for our younger kids who sometimes can be more impulsive. If you don't have sleep, it can be very obvious, but you'll have poor attention and alertness. And also your memory is not going to be so great. So think of if you're a child and you're at school and you learn something new. Think of it like a clothing that you throw on the floor. So you learn something in math class. That's a shirt you threw on the floor. You learn something in science class. That's some pants. If you get enough sleep, your brain will go and take that shirt, it will fold it, and it's going to file it away somewhere where you can find it again. Same thing with the pants, it's going to hang it up. But if you don't get enough sleep, what ends up happening is that the clothes just stay on the floor, and when you try to remember the things that you've been learning, it actually turns out you don't remember them, and your memory is much worse. Also, there's a direct effect on happiness and mood and sleep. And so what we find is that if you don't get enough sleep, you have higher risk of anxiety and higher risk of depression. And so think of your brain just like in California, where we don't have enough water right now, we're in a drought. If you're not sleeping enough, your brain becomes really ripe and ready to be set on fire. And so if something traumatic or something big happens in your life, your anxiety can go through the roof. You can become depressed and even start having panic attacks. So getting a proper amount of sleep not only helps you with your education and your memory, but it's also going to help you become more resilient as a person. Another thing when it comes to lack of sleep is that there's actually physical things that can occur if you're not sleeping enough. We've just talked about the mental aspect and the importance of sleep, but the physical aspect is also really important. We find that people who don't sleep enough, they have elevated blood pressure. They find people who don't sleep enough, they actually have what's called increased insulin resistance. And if your insulin resistance gets too bad, you end up with type 2 diabetes. They did a study on young adults and teenagers and adults where they sleep deprived them. And what they found is towards the end of the study that people were starting to become pre-diabetic. And I think obesity is already a big enough problem that we're dealing with in our country right now. And when you throw sleep deprivation on top of that, we're only making the problem worse. Also, it can also lead to obesity. If you don't sleep enough, it actually decreases a hormone in your body called leptin. And leptin is the hormone that your body has to kind of tell yourself to stop eating. And I joke, when I read this, I joked that, man, college, med school, residency, even now as a parent, I'm so sleep deprived. I think this is how I turned out to become overweight and obese. But one of the things that I found is once I started sleeping better, actually my eating habits actually got a bit better also. I think for many of us, some of us complain about having children who they're just difficult to put to sleep. And I have a lot of parents who say, yeah, my kids won't go to sleep. And then one of the first things that I always talk about when the child isn't sleeping well is what's our boundaries when it comes to sleep? What's our sleep routine? So my wife and I, ever since for both of our children, once they turned 6 months of age, we started doing a thing where we had a routine every single night. Every single night it was brush the teeth, take a bath, read a story, and then go to bed. And one of the things that one of my happiest and proudest moments as a father was when my son was about 17 or 18 months old. We read the story and I said the end. And he took the book, closed it himself, stood up, grabbed his stuffed animal, and then walked into his room. And I was so proud because he knew that the end of the story meant it was time to go to bed. And he's 6 years old now, and we still do the same routine. And I think he has some of my habits, and I am a little bit of a poor sleeper. But because of the routine that we baked into him, he's a much better sleeper than I was at his age. The other thing is just the computers, the TV screens, the phones. I think those should turn off at least an hour to an hour and a half before bedtime. We do find that there's a blue wavelength that comes from the devices that actually decreases our brain's ability to make melatonin. And melatonin is the hormone that actually helps us go to sleep. And so I have heard from some families that they have a phone in the room with the child, or there's a TV in the room, and their child doesn't sleep well. People will use the kind of excuse, oh, the TV helps me go to sleep, but long term it's actually hurting you. And so I would encourage turning off the electronics before bedtime. The last thing is that I think all of us to a certain degree have FOMO. And if you don't know what FOMO means, it's fear of missing out. And so our kids, when they go to sleep, and if there's people over or there's things going around the house that's exciting, or the TV's on, they have a hard time going to sleep because they want to be a part of it. And so if your child does have difficulty going to sleep, I do think sometimes we need to kind of take a step back and say, hey, we need to slow things down in the house so that our child can go to sleep. Being a busy pediatrician, I constantly am getting things done after my kids go to bed. My wife is, she's prepping for the next day, and we're both full-time doctors, and we do value that time after our children go to sleep. But if one of our children were having trouble falling asleep, we would have to kind of check ourselves a little bit and maybe decrease the amount of stimulation going on in the house. One of the questions I get a lot about is melatonin, and I think that there is a fair number of parents who use melatonin to go to sleep. One of my big things about melatonin is that it should not be your first resort. I think we should really be looking at why our children aren't sleeping, especially if it's a sudden onset. If it's, sometimes there can be things like a little bit of trauma in the house, like, somebody passing away, somebody moving. Sometimes it can be the first day of school because your child could be nervous. And in those cases, I don't really recommend melatonin. I actually want to see how the child does over time. But there's two different ways that you can dose melatonin. One is when you give a bigger dose, and it's about between 3 to 5 milligrams, and it gives what we call a hypnotic effect. So it's sleep-inducing, and then you would try it about 30 minutes before sleep. Sometimes if it's something like jet lag, you would do a smaller dose, anywhere between 0.5 milligrams to 1 milligram, and it gives more of what we call a chronobiotic effect, and this is where it kind of resets your sleep cycle. But in either case, I would say that I don't know if I want melatonin being the only thing you're going to. But one of the questions that we have as parents is melatonin safe? And I can tell you for sure that compared to when I started 15 years ago till now, melatonin is brought up much more frequently. But melatonin is well studied in patients who have autism spectrum disorder and also kids who have ADHD. But if you look at short-term uses of melatonin, it does seem to be very safe. There's not been any research to show otherwise. And even with long-term use, it does seem to be very safe. There was some animal studies that showed there may be some change in puberty. It's never been seen in children or in adults. But I would say that there hasn't been that 20, 30-year study that shows whether or not long-term melatonin use is safe. But if you look at the rates of ingestion or accidental overdose between the years of 2012 to 2021, there's been a 530% increase. And when I saw that number, my eyes got really big because that's such a big number. But one of the things that we'd be very careful about with melatonin is that one of the byproducts of melatonin is serotonin. And so if your kids are on any type of SSRIs, you can have what's called serotonin syndrome. What is it? In general, my edict with melatonin is that if you start melatonin, I always wonder if we can start to wean it off. So if your kid is sleeping consistently, maybe during a long weekend or a break, maybe we can try to wean it off to see if we necessarily need to be on that dose. So whenever school starts, I feel like everybody gets sick. And then my dad used to have a thing that, families that love each other share everything. And whenever somebody gets sick in the house, it seems like we share it with each other. I would say in general that the younger your kid is, the more often they're going to get sick. Kids that go to kindergarten and preschool who've never gone to a daycare situation before, they're like prime targets to get sick over and over again. I'll talk more about this later about my son, but when my son first went to tutor time, it was like he was sick every 10 to 12 days. So let's talk about some of the new things that we've been seeing in the news recently. So one of the big ones is monkeypox, and the president did declare a state of emergency with monkeypox. But when I heard monkeypox, I really thought I was back in the 90s and this was a Brad Pitt movie or something. What typically with monkeypox, I think as parents, we're kind of wondering What does that mean for my kids? So as of August 4th, there was only 2 cases of monkeypox in the U.S. Now, there was a case in Florida about 2 days ago, so I'm sure that number is higher. But overall, it seems like it was less than 0.1% of the cases in the U.S. were in pediatric kids. The people who are at highest risk are the ones who are immunodeficient, and also people who have skin conditions, things like eczema, where the integrity of your skin isn't very good, you're more likely to get infected. The common symptoms that you get with monkeypox are fever, headaches, fatigue, and the big thing is rash. And the rash is what we see on the news all the time. The rash, it starts as a red, flat, raised rash, and then it turns into blister-like areas. Now, when you look at the rash, sometimes it can get mistaken for chickenpox. Sometimes it can be mistaken for hand-foot-mouth disease. But one of the differences, hand-foot-mouth disease is one of those diseases that go around daycares and schools really easily. But one of the differences between hand-foot-mouth disease and monkeypox is that monkeypox, the rash seems to have a slower onset and it spreads slower, whereas monkeypox seems to spread slower, whereas hand-foot-mouth disease, it feels like one day it's there and then it's just all over the body by that night or the next morning. The other thing with that you can confuse it with, as I said, chickenpox. But if your child is fully vaccinated for chickenpox, the likelihood that your kid has chickenpox is very, very low. One of the questions that we all ask is how is it spread? And so really it's more from direct contact. If somebody who has monkeypox has a lesion that's oozing or that's open and it comes in contact with another person's skin or in sexual contact, you can get monkeypox. One of the ways I think we all fear about is like touching objects or fabrics or tabletops that maybe somebody with monkeypox happened to be sitting there or laying there before. That it seems to be much more rare. So for example, if you went to a hotel room, I don't think you need to strip down the bed to change it with something that you brought from home. Or for your children going to school, I don't think the school needs to wipe down all the surfaces before the kids come in the morning. I think that those occurrences have been very rare, and at this time, it's not something that we should have to worry about quite as much. It can be spread by respiratory secretions, but with respiratory secretions, that also seems to be rare. All the cases so far seem to be really more from high-risk interactions with people who have had a lot of skin contact. When it comes to vaccines and treatments, for various reasons, there's not a widely available vaccine at this time, and there's been some cases of giving post-exposure prophylaxis, but this is something that probably needs to go more through public health. The treatment of monkeypox also is kind of limited. It's for people who are really high risk, and then the AAP had made a comment about children less than 8. But once again, this is probably something that may go through public health or through your pediatrician or your primary care physician. One of the questions I think we all ask is, when should I go to the doctor? I think if your kid has a rash and you have had a confirmed high-risk interaction with somebody with monkeypox, probably something that you should get checked out. I do feel, though, if you have a rash and you do have a high-risk interaction with monkeypox, I do think it's nice to give the office that you're going to a heads up, and so that way they can give the staff and the doctors a heads up. Ever since the start of COVID, when COVID first happened and there was somebody coming in with a fever and a cough, watching us in the background is probably would be pretty entertaining to people. And so I think it'd be a nice thing, especially if the doctor wants to call public health or call an infectious disease specialist before you come in. It'd be nice to just give them a heads up. But anytime you have any type of fever and blister-like rash on the body, I do feel like you should probably get checked out by a pediatrician or your primary care doctor. Like I said, my son went to tutor time, and when he was about 13 months old, he had a fever on a Sunday at 103, and then on Monday I canceled clinic, stayed home with him, and he ended up having blisters in the back of his throat and all these spots on his hands. When he got better about 3 days later, and 3 or 4 days later, he was ready to go back to tutor time, and when I went into the classroom, there was one of my patients who 1 week ago I had diagnosed with hand-foot-mouth disease. And so I do think it's very important that kids get evaluated, because one of the things is that to help decrease the risk of spread of some of this even basic infections. One of the things that happened in the last few weeks is that polio came back, and so there was a case of polio in New York. It was one of the first reported cases in 10 years. The individual who did have polio was unvaccinated and had traveled across seas. But if we look at some recent reports, they've been testing the water for viruses such as COVID, but they also looked for polio, and there's polio in the sewer water, which means there's probably infections going on that people don't know about, and we are probably spreading it to one another. Common symptoms of polio ends up being fever, fatigue, headache, vomiting, diarrhea, and sore throat. So if you think that this sounds like any other virus that's out there, that's kind of true. And so I have a joke with one of my mentors, Dr. Chris Landon, who's a pediatric pulmonologist. And I tell him all the time, like, you saw stuff I never saw. Polio is probably one of them. Hib meningitis, pneumococcal meningitis. Those are things that because of vaccines that we hadn't been seeing that we're going to start to see again. One of the things to really keep in mind that it seems the numbers seem to be like 1 in about every 1,000 cases of polio, the virus will actually attack your nervous system. And so sometimes this leads to paralysis and other type of neurologic sequelae that occurs. And so, when people ask how it spreads, it really spreads in more what we call fecal oral. It can spread through respiratory secretions, but really more is what we call fecal oral because people, when they poop, there's virus particles in there, and then we touch them. So one of the ways that we can get is just not washing our hands after going to the bathroom or touching poop. And when I say touching poop, I kind of smile and laugh because I think we all have children, and we watch our children touch things in the restroom, whether it's our restroom at home or in the public restroom. And even when they're washing their hands, my kids, they both wash their hands, but their entire arm is resting on the side of the sink. Or when my daughter poops, her hands are actually on the toilet seat, and then she touches her face, and it just, you could definitely see how polio could spread that way. It can be from eating contaminated foods and water with contamination with polio. Also, if the chef hasn't washed their hands properly or the staff hasn't washed their hands properly at a restaurant, that would be another way that you could spread it. Swimming. And, I think we just, are at the tail end of summer, and people will have pool parties, and people will have parties with inflatable little pools and bounce houses. If you have somebody who has diarrhea and they're recovering from diarrhea, they can infect the water. And like I said before, touching contaminated surfaces. After my kids do wash their hands, I feel like I have to really keep them from touching other surfaces in the bathroom. And I've actually gotten a habit of carrying around sanitizer to try to sanitize their entire arm after they come out, because I feel like they touch everything on the way out. What can I do to prevent polio? Well, as parents, it really is to vaccinate. And then the next thing would be to wash hands well when you're in any type of restroom. So this is my little plug for vaccines in general. The CDC, they've shown very clearly that pre-vaccine to post-vaccine, if you look at the slide, the amount of decrease of what we see in hepatitis A, hepatitis B, measles, it's a really staggering number. If you actually add up all the people who've died in the different wars since the inception of the United States, and you compare the lives that we've saved from vaccines have saved more lives than people have died in wars. And so getting your polio vaccine, a lot of these things, they never went anywhere. There was a tribe in Africa that thought the U.S. was trying to poison them, so they weren't giving the pneumococcal vaccine. And within 2 years, the bacteria came back. And so it's not that any of these things really went away, it's that vaccines have helped prevent these infections from occurring. The other thing that I really like about polio is that if you look at the durability of the vaccine, polio is a pretty stable vaccine, and they did a study about a decade ago where they looked at people in their 40s, and they found people who were vaccinated with polio, 90% of them still had their protective antibodies to the virus. And so really this is a reason that we should vaccinate our children. Of course, in the last 2.5 to 3 years, we've been living with COVID. And I think there is no doubt that children in general do better than adults with COVID. But when I look at some of the things that are related to COVID, it still makes my skin crawl a little bit. One of them is just the total number of deaths of children and adolescents with COVID. And I know when you look at this number, 1,201, you tend to think, well, that's not that many. But kids are like brand new cars. Their body is so healthy and new, even the ones who have health conditions, that they tend to not die from any type of respiratory illness. And so if you say that within a year and a half, 2 year span, 2.5 year span, that this many children died from a respiratory virus, that actually is a huge deal in the pediatric world. I think we've all heard of long COVID, and that kids can get long COVID. I had a few patients that have had chronic headaches, chronic fatigue, can't go to school. And really, when it comes to our kids, we want them to be healthy, happy, and we want them to be able to live lives like other children. And sometimes when they have long COVID, I've had kids who had to go in home hospital just because their symptoms have been so bad. The other is what's called MISC. It's a multi-systemic inflammatory response in children. This is where you get COVID, and then 2 weeks, a month, 2 months later, you start getting like 103 to 104 fevers. Your tongue can turn into looking like a strawberry. Your eyes get red. And the big problem here is that if you get this, unless you get an infusion of antibodies and steroids, it can actually cause an aneurysm in your heart. This is very similar to a disease in the past that we called Kawasaki syndrome, and I've had a few patients who've had coronary aneurysms from Kawasaki syndrome. And those parents, every year they go to the cardiologist and they're just hoping, okay, did that aneurysm get bigger? Is my kid going to be okay? And it's just one of those things that if we can help prevent would be great. The last one is type 1 diabetes. I'm really good friends with Dr. Catherine Sever and Dr. Swati Alchuri. They're the two doctors in our county who take care of diabetes. And both of them have said that since COVID started, post-COVID, there's been so many kids who are ending up with type 1 diabetes. And this isn't just something that we've seen in Ventura County. This is something that we've seen across the nation. And though diabetes is a very, very treatable condition, it's also one that you have to live the rest of your life with, right? And so me as a parent, if this is something I can avoid, if this is something that my kid doesn't have to go through, I think we would want to avoid these things. I think the question I've been getting a lot in the office lately is, should I vaccinate my children? Because the vaccine has come out for kids greater than 6 months of age. One of the things I would say is anytime you do any type of medication, whether we're talking about melatonin or we're talking about COVID vaccine, you want to make sure you're doing something that's safe for your kids. You don't want to hurt them. And I would say that with these vaccines, they have been very well studied for safety. And then the other thing that's been very, very helpful is the fact that they had the interval between the vaccines between 3 to 8 weeks between the shots. So if you're getting the shot for your kid who is 7 months old, between the first shot to the second shot is anywhere between 3 to 8 weeks. And if you do go the 8 weeks, it does decrease the overall side effects. I know you probably heard a lot in the news about myocarditis and the vaccines. In general, myocarditis happens more in the post-pubertal population. Kids, it happens a lot less frequently, but I think spreading out the interval has been very helpful in decreasing that risk. But one of the things that's been helpful about the COVID vaccine is that definitely it's decreased the hospitalizations in children. So if you look at the Delta variant, only about 8.3% of the kids who were hospitalized were kids who were fully vaccinated. And then when you moved into December and January and they looked at the numbers with Omicron, it was only 22.2% of the kids who were hospitalized that were vaccinated. The other 80% were unvaccinated children. That's a very distinct difference. And so I do encourage for parents to get their kids vaccinated. I know that they're coming out with the Omicron bivalent vaccine, but I'm not actually sure yet. Is that going to be only for the high risk individuals first, and then is it going to take a while to get to the kids? One thing I will always say, not only is there COVID, but there's flu, right? And I do think it's very important for kids to get their flu vaccine. Kids tend to get much less sick and have much less secondary effects of flu when they do get their flu vaccine. But there's adenovirus, parainfluenza virus, human metapneumovirus, there's RSV, human rhinovirus or enterovirus. I think when we do a respiratory panel, there's 5 different types of coronavirus on that viral panel. And so kids are going to get sick all the time, right? And so, like I said before, if this is your kid's first time in school, they're going to get sick more frequently. When my son went to tutor time when he was 11 months old, like I said, every 12 to 14 days. And even when he went back to school, we had taken him out of daycare. And so when he first went back to school, even with the mask on, he was getting sick quite frequently. And then when the mask came off, he got sick again quite frequently. So this is going to happen. But if your kid does get recurrent pneumonias or they get recurrent ear infections, I do think that sometimes there's a little bit more of a red flag there. This is also why, if possible, to see your primary care physician. Though we have people who go to the urgent care and the ER, and they're such a great backup, especially for kids who are really sick. I, as a pediatrician, love to see my own patients, so that way I can get a better idea of, hey, that ear infection that looks, worse than last time, or it's the same ear, it's a different ear, and so I really think part of primary care, and the beauty of primary care, is for me to get to know your children better, and so that way I can help treat them, and then if we need to make a referral to a specialist, I understand the case much better. So I'm hoping that this slide will not be triggering for people, but I think there are some questions about whether kids should wear masks or no masks, and my wife and I talked about it, and my son does very well in a mask, and so last year we decided to have him wear a mask. But one of the things that we should always think about when our kids get sick is how long that they're going to be infectious for. And so it's very common for a person to be infectious, and we saw this with COVID a few days before they started symptoms, and then sometimes they can be infectious up to the point where until their symptoms go away. A person is most infectious about 2 to 3 days, the first 2 to 3 days of their infection, and after that, the viral load in their secretions tends to lessen. One of the things, like I said, when the mask came off, my son got sick over and over again. I think there's such a hard balance that we have as parents. When our kid's sick, we don't want our kid to miss too much school, but on top of that, we don't want to miss too much work for ourselves. I know for myself, whenever my kid got sick and I had to cancel clinic, I felt so guilty because some of you as parents have had appointments for a month or 2 months, and now I'm closing out the appointments, and you were telling me, hey, I had a hard enough time just getting this appointment. When can I get my appointment or get my physical in? And so one of the ways I think we could help prevent that is if your kid stops having fever and their cough has gotten significantly better, if your kid can tolerate it, to maybe have them wear a mask for maybe just 2 or 3 days, just to help decrease their risk of spread to other children. Now, I know that there's children out there with autism and intellectual disability, and that some children don't tolerate wearing a mask, and I totally understand that. I think this is just more if your kid can tolerate it and they can wear a mask for a few days. It just might be helpful just to kind of be good parents to each other and good neighbors, to just try to have it so that our kids miss less school, and we as ourselves as parents miss less work. The last thing I really want to talk about is screen time, and I really feel like the way that screen time is nowadays, it's really changing our world, whether it's the TV, the phones, or the tablets. Currently, the recommendations for screen time, if you're 0 to 24 months, is supposed to be 0 screen time. Now, the AAP does give a caveat for FaceTime, so if you have grandparents or relatives that live far away, they don't necessarily consider screen time when you're conversing with family. But at 2 to 5 years, trying to keep that at 1 hour screen time a day. And then if you're greater than 5 years of age, to 2 to 3 hours of recreational screen time. And I know that gets hard because some of our kids have devices for school and they got to do their homework, but recreational use should be about 2 hours a day. So the Kaiser Foundation did some research, and they're finding that kids between the ages of 8 to 18 years, that they're averaging about 7.5 hours of screen time per day. That number just blows my mind. It makes me wonder, did these kids do anything besides watch a screen all day long? But I think that there are many families out there that the kids are on the screen way too long. Common Sense Media found that there was an upswing in social media use in kids ages 8 to 12 years of age. And actually many of these apps, whether it's TikTok or Twitter or Facebook, Instagram, they actually have a recommendation that your kids shouldn't be on it unless they're over the age of 13. But I think that when it comes to social media, that we have to be really mindful that things that are on TikTok and YouTube, that sometimes our kids actually are not ready for the maturity level of the content that's on there. And so we should be very mindful of what our kids are watching anytime they're on any type of screen. One of my pet peeves is when kids have headphones on. I know that sometimes they can be loud, but I think you want to actually be listening to what your kid is listening, because sometimes that can be a clue that your kid could be watching something inappropriate. Definitely, social media definitely has addictive properties. They actually found that, let's just say, for example, Instagram is going off. And as we've been talking, I don't know if my friends are online, but my phone keeps buzzing. But when you reach for your phone and you look at your watch and you look at a like, there's actually a dopamine response that goes into your brain, and that's part of your pleasure cycle. And so there are people who are actually, that dopamine response is very similar to when you do drugs, and they're getting very addicted. So if somebody likes you or follows you on social media, you get that pleasure response. And many teenagers are addicted to how many likes or how many followers they have. It's as if their entire self-worth is tied into how many followers, how many people liked my picture today. They're calling their friends, say, hey, I don't have enough likes. Can you like my picture because I need more likes? And it's as if they're craving that experience. But it's also increasing feelings of loneliness and not fitting in. And so you can imagine, I used to have a thing. I was, for a short time, a youth pastor, and I used to tell the parents in my church that this is in the early 2000s, that if anybody would offer me $10 million to be a teenager again, I wouldn't do it, because it was just so hard to fit in. It's so hard to feel accepted no matter how social you are. And now we have these devices where people feel like they fit in or they're accepted based on the amount of likes or based on the amount of followers. Or if they get blocked by friends, the sense of rejection is like as if you got dumped. But the other things that we find with social media is, whenever you swipe down to refresh your screen, they actually find that response very similar to like pulling a slot machine. And so even just the idea of refreshing your screen can become very addictive. Games such as Roblox, Minecraft, Fortnite, they're all extremely addictive, and the video game companies, they've been making it to be more addictive for our children and for us as adults. But they've even found things on Roblox where there are secret rooms where they'll do like pornographic type things with the innocent animation and expose our children to things like that. Possible downsides of having a phone or tablet time. One is the low self-esteem. And also, when it comes to things like Instagram, I almost call this kind of the Kardashian environment we live in our lives right now, where we feel like we should look a certain way, we should dress a certain way, but also that our children and even ourselves start to get this feeling that we need to have the latest and the best. My friend, his parents bought him new Jordans, or they bought him new clothes, and they think that their life needs to measure up to the life that people present on Instagram. I know for some of my friends, I would have friends who they post pictures of their families and everything seems perfect, but then like 3 months later, I know one family that got divorced, and I realized when I looked at their Instagram photos that their life that they portrayed on Instagram didn't match what their life was in real life. But our kids are getting that same thing. They're seeing pictures of their friends and they think their life is perfect, and when they feel like their life doesn't match up, they starting to feel anxiety and depressed. There's also increased feelings of isolation and loneliness. So that word again, FOMO, the fear of missing out. Sometimes if they're not online, they're worried they're going to miss out on something. They're worried they're not going to see something. Or, I have some parents who they've been really good and they try not to let their kids be on social media, and the kids feel like they're missing out on an important part of what they consider to be their life, when really it's just some social media. It can lead to increased feelings of anxiety and depression. But the other thing is that it can also cause some increased risk of social anxiety disorder. I joke, my wife and I, we actually, before we started dating, we did a lot of texting to each other. And when we first went on our first date, we had to kind of get outside of that mode of, we're not texting, we need to learn how to talk to each other. And I think many kids have become more and more awkward in how they talk to other people. I find this in my teenage physicals, that sometimes kids are just not as expressive. And I almost joke that maybe if I would just text them, they would actually give me the answer better than talking out loud. It's definitely, we talked before, disrupting sleep and decreasing activity level. If you actually look at the amount of screen time a child does, each hour of screen time actually will have a correlated increase in their obesity. And so it's definitely leading to more sedentary lifestyle. And also just the ability not to be able to empathize or sympathize with other people. I've heard so many people say this, feel like Twitter is just an angry place. But we actually see that on Instagram, you see that on Facebook, where people are just overtly mean to each other, and they don't realize that they're being actually really horrific, and the person who's getting bullied on the other side, it really does affect them. And then the last one is just exposure to pornography. I'll get to that in a second, but the exposure to pornography is ginormous. Red flags that your child might be addicted. If your kid gets up and the first thing they're looking for is the tablet, or anytime they get free time, probably a red flag that your kid's addicted. You might have a problem if it's their way of coping with problems. You tell them no for something, and they go to the phone for to soothe themselves. If they're restless or they're irritable when they're not getting screen time, you might have a problem. We have a rule in my house that if my son Ben or my daughter Abby, if they cry about screen time, the next day they get 0 screen time. And the reason we have that rule is because if you're crying and having a temper tantrum about the screen time, it's probably a little obvious that you like it a little too much. And so if there is anger when screen time is reduced, I think that there's a definite red flag there. I remember in my clinic one time, there was a kid who was about 9 years old, and the mom said, we got his iPhone out, we looked at the screen time app, and he'd been on the phone for literally 12 hours a day, staying up till 2 in the morning. And mom said, you know what, that's it, we're gonna, I'm taking that phone away. And he got up and he kicked the window in our clinic so hard. If it wasn't basically bulletproof, I think he would have broken it. But it was the same response I saw with drug addicts. When we tell them, hey, you're going into rehab, and the amount of cursing and screaming and throwing things, it was the same response. And so if we don't think that some of our children are getting addicted to these devices, I think we're actually fooling ourselves. If we look at generalized anxiety, so since the start of COVID till now, definitely anxiety has gone up, but anxiety has actually been going up before that. And so if you look at this slide, smartphones right around 2011, that's about when I got my first smartphone. If you look at the rates of anxiety, it's actually been going up. And then if you look at the rates of suicide, and you correspond that with when Facebook started, Twitter started, smartphones, Instagram, Snapchat, that peak, it's going up quite rapidly. And so this is one of those things that we need to ask ourselves, what are we exposing our children to? And it's such a hard world because this is something that many of us didn't grow up with. We're kind of parenting on the fly here, but we've got to ask ourselves, are we harming our kids, or are we actually helping them and preparing them for the future? So the one thing I said we would talk about pornography. So believe it or not, the average age a male watches pornography in the United States is at the age of 11. My son's 6. There is no way I would ever think that in 5 years that he should ever watch pornography. But if you look at the unfiltered internet and the video content on the internet, 27% of the videos on the internet is pornography. They actually had analysts look at pornography, which don't even get me started that there's somebody that's their job. But what they found was that 88% of the 50 most popular pornographic videos contained violence, and 49% of them had verbal aggression, and mostly against women. And so just away from my son, I want him to be a good kid. I want him to be a gentleman. I want him to know how to treat people. And I'm worried that there's so many kids who are watching pornography, and the idea they have of what relationships are with with a spouse or a significant other is violent or degrading. And they've found that elementary school children have been seeking pornography because of their exposure. One of my colleagues had a girl or boy who had been watching pornography for a while. And when the reason the parents found out is because he was trying the things that he saw in the video on his little sister, right? So we have to be really, really mindful and careful about what our kids are being exposed to. Bullying is a big thing, but and when I think of bullying, I always think of the fact that growing up in Ventura, so I went to Will Rogers and Lincoln and Cabrillo and Ventura High School, and growing up, there weren't that many Asian kids growing up, and so I did get a little bit of bullying. But one of the things I do worry about is more bullying online. There's bullying through text messages and social media. There's people who are body shaming other children. I even had a patient in this past year where she showed me text messages where her classmates told her that she didn't deserve to live, that she deserved to die, that she should hurt herself. And then also, some of the bullying happens to, oh, hey, block so-and-so. And so I think when we talk to our kids about treating others with respect, this also goes to as they get older with the way that they interact with other people on social media. As I said before, when it comes to increased screen time, we are losing that sense of empathy and sympathy, and our kids are sometimes just becoming much meaner when they're online. Bullying in person, I always, when I see a lot of kids, whether they're in elementary school or middle school or high school, I do ask, hey, is there anybody who's messing with you, any bullies? And it's actually surprising the number of times the kids will tell me about a bully and the parents weren't aware. And so I think it's really, really important to ask your kids about, are there any bullies at school? Asking your kids about, who their friends are, anything happening at school, anybody who's making them feel uncomfortable. My son Ben, I ask him all the time, and I actually like listening about the kindergarten gossip, and so I ask him all the time about his friends and who he hung out with and what he did. But I do think, even in our busy lives, just always remembering to ask our kids about what's going on. In general, I do feel like kids who are in elementary school don't tend to keep big secrets from their parents, and so just reminding them, no secrets, okay, and then just to have a good open line of communication. And the other thing I always say is that just making sure that we also reiterate to our children not to be bullies themselves. I've actually had a couple of times where a kid reported to me he was being a bully, and then when we came back a year later, 6 months later, 3 months later, I said, hey, how's the bullying thing going? And the mom actually got kind of quiet, or the parent got quiet and said, yeah, actually, it was my kid who had started it, and we had to deal with it on our end. And so just making sure we're talking to our children about treating everybody well. And also just talking to our children about the fact that different is okay, that we don't come in one color, one size. I remember when the mask mandate went down, and my daughter, she hadn't been vaccinated yet, and we were just kind of worried, and we had asked my son to keep his mask on, and I think he was really anxious about the fact that he might be the only person wearing a mask. And so just making sure that we're talking to our children about being a little bit different is okay, and that we don't point it out, we don't make fun of people, and just to make it so that school is a safe and more enjoyable environment for all of our children. The other last thing I'd really like to talk about when it comes to screen time is just stranger danger in children and older, right? And so I think for all of us, we do talk to our kids about stranger danger, but one of the things is that as our kids go to preschool, kindergarten, further into elementary school, they start to lose some of that stranger danger. They start to be more brave about who they talk to. And so I do think that sometimes we fight this balance as parents of wanting our kids to be respectful and say hi to people, but at the same time not talk to people. But as your kid gets older, just making sure we're still talking to them about strangers, that we don't go off with somebody we don't know. We don't just go randomly walking up and talking to people that could potentially be a predator. But I think also when it comes to being online, and I think this has been very well documented, that there's predators online. There are people who they see underage boys or girls, and they want to friend them. And I always try to make sure that if I have a patient who's on Instagram or whatever the social media platform, telling them, hey, if a person you don't know friend requests you, I think you should reject it. And I also think that you should be very open with your parents if there are somebody who's following you that you might not know. And also, I think when it comes to video time, whether it's FaceTime or direct video chat on Instagram, I think, as a parent, we should all have rules of what's okay and not okay. Because sometimes there can be, a predator who's trying to have a video conference with your child. And so I think all of these things, like I said, this is a brave new world out there that we're living in with these devices. But I think it's really, really important that we have boundaries and we start to have a philosophy of how we raise our kids in this environment. So that is my presentation, and I know. So I've been actually practicing pediatrics in the community in Ventura for 12 years. As I mentioned before, I was born in Korea. We moved to Ventura when I was 5, and I love living in Ventura. I'd never want to live anywhere else. I have been practicing in town for about 12 years, and I recently shifted my practice over to Community Memorial Health System. And so if you're wondering where I went, this is where I am, and I'm over at the Ashwood Clinic right now. And I do, we take a host of insurances, and right now there's about 3 insurances that we're still working on the paneling in. That's TRICARE, Seaview, and First Health. And so, but if you're looking for a pediatrician, I'm always here. I love seeing the kids that grew up in this community. I feel like since I grew up here, I feel like doing a good job of helping you raise your children makes our community stronger. So we're going to take some questions. And so this is just a picture of my kid, Ben. This was his last day of school. and then also had his graduation with his little sister Abby. And I think this is what we want, right? We want a healthy first year of school or this year of school. And so if there's any questions regarding things that we should do for our children, I think bring them up with your primary care doctor. I mean, I think that's, sometimes your yearly physical is your time to ask those questions that sometimes, the only other people sometimes you ask is your family, and sometimes there's a little bit of a biased opinion. And so I'm always happy to answer those questions, and I'm sure your doctor will too. So our first question is, should I lie down with my child to help them fall asleep? So that's actually a really good question, and it depends on the child and the age. I do think that children need to learn how to fall asleep by themselves, but sometimes it's really hard. Sometimes it's dark. Sometimes they're scared of the dark. And so the one thing that I always get with some parents is they say, I will fall asleep next to them, and then I will leave. And then when they wake up, they run and come and try to find me. And so one of the things that we need to keep in mind as parents is that when a person, whether it's an adult or a child, falls asleep, you take a mental picture of what that room looks like. And when that mental picture changes, when you wake up, it startles you awake. So my wife is actually a neonatologist, and she's on call. And so there are times where we will fall asleep, and when I wake up, she's not there because she got called into the hospital. Whenever that happens, I have a moment of what's going on. Where is she? Is she? And then I'm like, did she go to the restroom? And then I'm looking at my phone. Is she at the hospital? And the same thing can happen to your child. So the goal is that your child should try to be able to fall asleep by themselves. And so what sometimes we recommend is that at first you start with falling asleep, having your child fall asleep with you laying next to them. And then after maybe a few weeks, you sit on the bed next to them. And then after that, you're at the foot of the bed, sitting next to them. Then in a chair, and slowly that chair goes outside. And so that then they start to get more and more comfortable with you not being there when they fall asleep. So that when they do wake up in the middle of the night, it's just, it's dark. This is how I fell asleep. I'm going to go back to sleep, instead of, where did mom go? Where did dad go? I need to go find them. Yeah, is vaping addictive, and are there health concerns associated with teen vaping? That is, actually, this is the one guilt, and I knew I was going to talk too long, because in my family, if you say 5 words when you could have said 15, you're just not trying. But I did miss an opportunity to talk about drugs, and vaping is such a big deal. I mean, there are so many health concerns associated with teen vaping. Prior to the pandemic, I think you could Google it if you want to, there was a teenager in Michigan who had to have double lung transplant from the effects of vaping. There's micro metals in there that causes inflammation that is so much worse than even doing cigarettes, and they get so addicted. I had one of my teenagers who was vaping so much that our pediatric pulmonologist, Dr. Landon, had said that he had caused irreversible lung damage, that his lungs, if he kept this up, was going to be like one of those COPD patients who've been smoking for decades. Our next question is, do you recommend that kids wear a mask to school even if they are vaccinated? To be honest, I think that this is more of a personal choice that parents should make, right? My son was fully vaccinated. He was, just because of me being a pediatrician, he was probably one of the first kids in the county to be able to get his vaccine. But I did decide that I did want him to wear a One of the reasons was because his grandparents, one of them has a heart condition, has a pacemaker, and so even though he was vaccinated, I thought, it's not worth that risk, right? As I said, my daughter at the time wasn't vaccinated yet, and still there are breakthrough infections, and so I think it's really the comfort level of you, and then also the comfort level of your child. And like I said, but I do feel like if your kid is even just sick with a cold, that it'd be nice sometimes to wear a mask after the first few days of going back to school, just so we don't spread it to other children. But I don't think that if you have a child with high anxiety and it's going to make them really uncomfortable, or they're going to have maybe even a panic attack. I think we all kind of do that based on our child, our risk factors in our lives. But I think this is why we do vaccinate, right? So we don't have to mask as frequently or have universal mask policies. And so this is why I would plug even getting vaccinated. And the next question is, do you have any experience treating children with autism spectrum disorder or other special needs? So the answer is absolutely yes. My wife jokes with me that on some of the mommy boards on Facebook that my name comes up quite a bit for special needs kids. I don't advertise myself as any smarter than other doctor. I don't think that I'm better than anybody else. But I do feel like this was my calling, that God put me here for a reason. And I feel like parents of special needs children, whether it's autism or it's any special needs, I actually feel like those parents have a free pass to heaven, because if you guys don't make it to heaven, I don't know who else deserves to go. And that's why sometimes if you see me, if I'm falling behind, it's just because I do sometimes have some very difficult patients with behavior issues. I've been known to examine and get the history for my patient in the parking lot because we couldn't get them inside the clinic. And so sometimes I do run behind, but that's because I'm trying to take best care of your child as possible. And I will promise that if I'm late to your appointment, I'm not going to rush out just to get to the next one. I'm going to try to hear all your concerns and take my time. But yes, I do feel like I have a pretty good 12-year experience of taking care of special needs children. And also I trained at Loma Linda, where there were a lot of special needs children there. Next question says, my son has Valley Care IPA. Can they see you at Centers for Family Health? So yeah, I've had some questions about that. So clinic currently, Community Memorial Health System does not take Valley Care IPA, but through your insurance, you can actually switch over to Seaview. You just need to call your insurance company and say, hey, I would like to switch over to Seaview to see Dr. Lee, and then we can make that happen. The next question is, should a teenager still be seeing a pediatrician, or should they see an adult doctor for adults? That's a very good question. I think one of them, sometimes it does depend on your child. Sometimes your child does not want to see the pediatrician anymore. But I do find that seeing teenagers is actually a very rewarding experience for not only myself, but for also the patient. I think as they get older, when they've seen the same doctor for a long time and things get kind of sideways in life, that they actually trust the doctor in front of them. I think one of the great things, and when I said before that I would love to see my patients more often, is that so we develop that bond. And I think as parents trust their doctor, I think the kids trust their doctors when they get older. And so sometimes there are times where the kid just doesn't feel comfortable telling their parents about something, right? And so they come to the office, and usually for like a teenage physical, I'll try to give your kid, just an alone time for them and I to talk. And they can talk about things like whether it was bullying, whether, there's other things going on. And so I really, really do think that teenagers is part of my practice. I've actually been known to hang on to some kids a little bit longer. I do feel like the first year of college is really tough for teenagers, and so I usually tell them, hey, as long as you're not doing drugs, you're not getting arrested, and you're not pregnant or didn't get somebody pregnant, like, I'll keep seeing you, because I am a pediatrician. I don't want to scare the people in the waiting room, but also if you have a kid, I should probably be seeing your kid and not you. But even then, I've had caveats because of some special needs that the father had, and I needed to see both the father and the son. And so, but yes, absolutely, I think teenagers should still see their pediatrician, and that they don't have to transition to adult care. The next question is, should I give my kids supplements or multivitamins? And that's a really good question. To be completely honest, I do feel that multivitamins in general is overrated. I think that kids should try to eat a healthy diet. So those of you who know me know that I actually broke my back about 7 years ago. I had a compression fracture, and it was recommended to me to take more vitamin or take more calcium for my bone healing. And when I did so, this is going to be a little bit of TMI, but my urine was really dark, and I drink a lot of water. And so I called one of my friends, and he said, well, yeah. He's my friend who's a nephrologist. He said, yeah, that's because you have too much vitamin in your system. Your body's just trying to get it out, right? And so sometimes I joke with parents that when they're giving their kid a multivitamin, that really all you're doing is making really expensive urine. But the other thing, like I said, sometimes I also feel like we give it to them in gummies, and that actually activates their sweet tooth, and then they end up wanting just more candy than anything else. the likelihood that your child is going to be vitamin deficient because they didn't get a multivitamin is really, really low. And what I would say is, and I get this, and I don't know if my kids are still watching this, but my son Ben and my daughter Abby are picky eaters, and we're fighting with them all the time about food. But we try to have boundaries. What I would say is, instead of going to the multivitamins, really just like sleep, is trying to fix the behavior. Last question. When should I set up my first appointment after my baby is born? So I think that there's actually two caveats to that. One is sometimes I think especially for first-time parents, they like to actually meet the pediatrician beforehand, and I think that's not a bad idea. My analogy for your doctor is sometimes it's like shoes. Sometimes you buy a pair of shoes and they look fantastic, but they actually feel like rocks on your feet. And so sometimes it's just nice to be able to talk to your doctor before you have your first child. But when you should see the first appointment after your baby is born is you actually do need to talk to the doctor who's taking care of your baby in the hospital. There are various reasons why you get seen earlier versus later, and one of them is jaundice. Sometimes babies do need to be seen that next day. Sometimes babies need to be seen 2 to 3 days afterwards. But I usually say, usually within 2 to 3 days if possible. There's so many things that are going on in your life when you have a newborn, especially if you're breastfeeding. Has your milk come in yet? Are they peeing? Are they pooping? Are they sleeping? And then just like, how are you doing as a parent? My joke when it comes to babies is that, and take this with the initial part with as a joke, but it's the worst thing that has ever happened to you because you're sleep deprived, you're exhausted, if you're a first time mom or you're breastfeeding, things hurt, your hormones are going crazy. And so I think sometimes it's just a really good reason to check in with the doctor, right? And so when you come see me, you'll get a handout that's called a postpartum depression screen, and that's just to make sure that you're okay. It's not a judgment call at all about how you appear, but what I want is a safe environment for you and your baby to just make sure everything's okay. But once that child starts to smile and they make eye contact, I joke with my wife that when they put my son on her chest, I realized I wasn't the love of her life anymore, that I was definitely second. And then when they put my daughter on her chest, I realized at least I was a bronze medal. But I said, I usually say, like 2 or 3 days, but really do listen to the staff in the hospital. They're going to help guide you when it's the first time, best time to come see me for the first time. I think those are all the questions we have tonight. Thank you for joining me. I know that you guys are all busy right now getting ready for school and the first days of school. But I hope that we all have a great first year if it's your kids going to kindergarten or whatnot. And if you guys invite me back again, we can talk about some other topics. You guys have a good evening.